People living with common inflammatory conditions such as COPD, asthma, and rheumatoid arthritis often need to turn to specialty medicines to manage their conditions. Now, those medicines can in turn have negative effects on things like bone health. Now, here to discuss is Dr. Ronald Emke. Doctor, thanks so much for joining us.
It's my pleasure, Alex. Let me try to simplify this a little because it is a complex subject, and that is glucocorticoid-induced osteoporosis. Basically what that means is that patients who are taking medications called corticosteroids, of which prednisone is the most common name, and I think that'll define it for most people, they are suffering because of the risk involved with these medications on bone metabolism that leads to, as a direct effect of prednisone on bones, that leads to a thinning of the bones, a weakening of the bones, and the propensity to fracture because they are more brittle. And this becomes a complicating factor in patients who are on prednisone for lengths of time, regardless of the basic disease. But the complications are such that if you have someone in COPD and they fracture some vertebrae, it reduces the tidal volume of the lung and the vital capacity, can enhance breathing difficulties, and so on. So we'd like to prevent that if at all possible. There are medications that have been used to treat this. The newest one, and the one that just gained approval recently, is Prolia, and that is makes us happy as practicing physicians because we have options now. However, all the medications have potential benefits as well as side effects, and not every patient is suitable, not every medication is suitable for every patient. So you really should speak to your physician so he or she can decide whether or not you need a medication, if so, which one is most appropriate for you.
Right, understood. A very simple way to put it. I'm sure everybody can grasp that and understand it. Now, having said all of that, who is at risk? What are the risk factors of developing osteoporosis from these types of medicines?
Well, I'll cite a study for you. There was a recent study published in which patients who were both men and women who took prednisone 10 milligrams a day or more for 3 months had a 17 times increase in the number of vertebral fractures and a 7 times greater increase in the number of hip fractures than patients who were not taking the medication. So that's an overwhelming statistic. So basically, the way you define that and look at that is patients that are taking prednisone for long periods of time, and the actual indication is for patients taking 7.5 milligrams of prednisone that are either starting it or continuing with it, but are likely to continue with for another 6 months. These are patients that you should talk to your physician about treating, because they may well be the patients at highest risk for fracture.
Right. It's nice to see that, you know, as always, science is advancing. There are new medicines that definitely decrease the risk of having something like osteoporosis. So if people want to learn more information, obviously they should partner with their doctor. They're the real expert on all of this.
Yes.
But if they want to learn about Prolia a little bit more, where can they go get resources?
They can get that from their physician as well. Most physicians are very well aware of this because it has been utilized to treat postmenopausal osteoporosis for several years, and it reduces the incidence of vertebral, non-vertebral, and hip fractures in that particular condition, which is a lot more common than GOP, which is the glucocorticoid-induced osteoporosis. Both entities can result in fractures, and for that reason it's important to define them and to treat them as early as you can.
Very good. Dr. Ronald Emke, thanks so much for the information and your time today.
Thank you, Alex.
Definitely. And stay right where you are. We'll be right back.